Hospitals have doors that are supposed to stay closed. Locked units, sealed stairwells, restricted wings, supply rooms with badge access, ICU doors with alarms, and psychiatric areas with multiple layers of security for a reason. But every night shift has at least one story about a door that did not care what it was supposed to do. This is one of those stories. Welcome to Hospital Horrors, where we explore unsettling true stories from real hospitals and medical facilities. These are the incidents whispered about during night shifts, the moments staff don't forget, and the cases that never make it into training manuals. Tonight's story comes from a hospital built in layers, with renovations stacked on top of older renovations, like someone kept adding rooms and hallways and hoping nobody would ask too many questions about what used to be there. On one particular night, at 3:12 a.m., a door on a locked corridor opened without a badge, without a code, and without anyone appearing on camera. Names and identifying details have been changed for privacy. It was late fall, the kind of night where the wind sounds like it's trying to get inside. The hospital was short-staffed, as usual. 2 nurses on the unit, 1 tech floating between rooms, and a charge nurse juggling problems that never stopped arriving. The unit was an older medical surgical wing connected to newer additions. Patients ranged from post-operative recoveries to respiratory infections to complicated medical cases that had already been admitted for far too long. On the far end of the hall was a corridor everyone called the dead stretch. Not because people died there more often, but because it was quiet. Too quiet. The lights seemed dimmer, the ceiling felt lower, and the air was always colder. At the end of that stretch was a door with a small window and a keypad. Behind it was a decommissioned section of the hospital, overflow storage, old charting stations, and a stairwell that no longer counted as a legal exit. The door was always locked. The nurse telling this story, we'll call her Mara, wasn't superstitious. She believed in policies, vital signs, and documentation. She trusted routines. That night started like any other. Pain medications were due. Someone needed a new IV after blowing a vein. A family member refused to leave after visiting hours. Nothing unusual. Just after 3 a.m., Mara heard a sound she couldn't immediately place. It wasn't a call light. It wasn't a monitor alarm. It wasn't the ice machine. It was a slow, soft click, followed by a faint scraping sound, like rubber soles against tile. Mara looked down the hallway. The keypad door at the end of the dead stretch was open, not wide open, just enough to create a narrow wedge of darkness behind it. The strangest part wasn't that the door had opened. It was that the corridor behind it looked darker than it should have been, as if the light from the hallway refused to spill inside. Mara did what nurses are trained to do. She assessed the situation. She called out, assuming maybe security, maintenance, or a confused patient had somehow accessed the area. There was no answer. She walked closer, slowly, listening for footsteps, breathing, anything. The door made no sound as it moved, even though it should have. Even a well-maintained hinge makes noise. Mara stood at the small window and tried to see inside. There was nothing, just darkness and the reflection of her own face under the fluorescent lights. She reached for her radio, and then the door shifted. It didn't close. It opened a little more, as if someone on the other side had heard her footsteps and adjusted their grip. At that exact moment, a patient call light went off behind her. Room 214, a fall-risk patient with a bed alarm who had been trying to get up all night. Mara hesitated, torn between the open restricted door and the immediate priority behind her. She turned away for maybe 10 seconds, just long enough to get to the room and stop the patient from standing. When she came back into the hallway, she froze. A figure was now standing in the dead stretch, halfway between her and the keypad door. It was a man. He was wearing a hospital gown. He was barefoot. There was no wristband on either arm. And the way he stood was wrong, too still. like he had been placed there rather than having walked in. Mara asked the obvious question. "Sir, are you okay? What room are you in?" The man didn't answer. He tilted his head slightly, as if listening to something behind Mara, something only he could hear. Then he began walking slowly toward the nurse's station. Mara followed at a careful distance, keeping her voice calm, the way she had been trained to with wandering patients. As he passed beneath the hallway lights, she noticed details that made her stomach tighten. His gown was an older style, the kind the hospital hadn't used in years. The seams were different. The ties were wrong. His feet were dirty. Not like someone who had just gotten out of bed, but like someone who had walked through dust and grit. When he reached the nurse's station, he stopped and stared at the locked medication room door. He didn't blink. Then he lifted his hand and pointed down the hall, toward room 216, a room that had been empty for weeks due to a plumbing issue that still hadn't been fixed. The charge nurse stepped in, asked the same questions, tried to get a name. The man didn't respond. Security was called. When security arrived, the man turned around and walked back toward the dead stretch. Not fast, not panicked, like he wasn't worried about being followed. He reached the keypad door and stepped into the darkness beyond it. Security moved in immediately, right behind him, and the corridor beyond the door was empty. No man, no footsteps, no open stairwell, just stacked equipment, dusty chairs, old signs, and a cold draft that raised goosebumps on Mara's arms. Security searched every corner, every closet, every stairwell door. There was nowhere a person could have gone. So they did what hospitals do when something doesn't make sense. They checked the cameras. The footage showed Mara walking toward the dead stretch. It showed the keypad door opening. It showed her backing away. It showed her leaving for room 214. It showed her returning. But it did not show the man, not standing in the hallway, not walking toward the nurse's station, not pointing at room 216. The footage showed Mara and the charge nurse reacting to empty space, following empty space, security arriving and moving toward empty space. The next morning, Mara couldn't let it go. During day shift, when the halls felt safer and sunlight made the hospital feel almost normal, she went back to the dead stretch. Beside the keypad door was an old sign, partially covered by newer directional signage. The adhesive had failed, allowing the older label to peek through. It read, "Rooms 210 through 216, observation." Mara asked an older staff member about it, someone who had worked there long enough to remember when that wing was active. The staff member looked at the sign, then at Mara, like she'd said something she wasn't supposed to say out loud. "That hallway," they said quietly. Mara waited. "That used to be overflow, temporary holds, people who didn't have placements yet, people who didn't always make it." Mara asked about room 216. The staff member hesitated, then said just as quietly, "That's the one they found him in. Maybe there's a rational explanation. A glitch in the camera system. A patient transferred incorrectly. A mistake caused by exhaustion and memory. But Mara knows what she saw. She knows that door opened at 3:12 a.m. She knows a man without a wristband walked the hallway like he belonged there. And she knows security followed him through that door into a corridor that had nowhere to hide a person. In a hospital, you learn quickly that some doors aren't just doors. Some are boundaries, and sometimes at the wrong hour, those boundaries don't hold. If you have a hospital or medical horror story of your own, we'd like to hear it. Have a hospital or medical horror story to share? Email us at hospitalhorrorstories@gmail.com, and we might feature your story in a future episode. Until next time, keep the lights